Infection control orientation prepared by Mr. Sally. Infection control orientation in Ginserman Hospital. Infection control team members. Infection control director, Professor Sedan Sedan. Infection control officers, Dr. Samara Kap, Dr. Samasat, Munira Tagrit. Infection control practitioners, Sister Sally, Shamna, and Rhoda. And we have public health team members. Infection control manual. It is available in the desktop, in the shared file, updated on 2022. It is valid up to 3 years. Our education plan. Infection control training program upon hiring periodically. Any new issues update annually. Evaluation done by test, observation, interview or competency. Infection control program. Program leadership and coordination. Performance improvement projects. Risk assessment methodology. Strategies for reducing infections. Surveillance methodology. Infection control indicators. Health electronic surveillance network program, that is HSN Plus. Education program. Communication strategies. Influenza, SARI program. Corona program. Monkeypox program. You will see the chain of infection. There should be a infectious agent, reservoir, portal of exit, mode of transmission, portal of entry, susceptible host. This is the chain of transmission. Standard precaution. What is standard precaution? Standard precautions are infection prevention and control practices designed for the care of all patients regardless of their diagnosis or presumed infection status and for the safety of all personnel and visitors. Standard precautions are measures designed to reduce the risk of transmission of infection. Hand hygiene, either antibacterial soap and water or alcohol-based waterless hand rub. Hand hygiene is used to kill microorganisms that colonize the hands. The 5 moments of hand hygiene. 2 before, 3 after. Before touching the patient, before doing any clean or aseptic task, after body fluid exposure risk, after patient contact, after contact with the patient surroundings and environment. This is the technique, how to wash with the soap and water. Here the importance, the duration, that is 40 to 60 seconds. This is the picture, how to do the hand rub with alcohol sanitizer. Duration will be 20 to 30 seconds. Use appropriate personal protective equipment. PPE is used to create a barrier between healthcare workers and patients, body substances or surfaces. Use appropriate PPE like gloves, gown, plastic aprons or eye protection to prevent skin and mucous membrane exposure. Use one or more of these items based on the degree and risk of exposure. However, most routine care activities at the bedside do not require the use of PPE. Gloves. Where you have to wear the gloves. Wear gloves whenever in contact with the blood, other body substances or contaminated items and surfaces and when in an isolation room. Wear and change gloves between task procedures on the same patient. Remove your gloves promptly after use and before touching clean items and environmental surfaces. Perform hand hygiene immediately after removing gloves. Use non-sterile gloves or examination gloves and other clean procedures and sterile gloves for sterile procedures. Gloves are not to be worn after leaving the patient room or procedure area. Wear a gown or plastic apron to protect skin and clothing during procedures that may generate splashes or aerosolization of body substances and cause the soiling of clothes. Securely ties to keep the gown in place while performing patient care activities in the patient room or procedure area. Remove the gown by untying the tabs and folding it away from you in an outside manner. Roll it into ball and discard. Change gown for each patient and procedure. Gloves and gown are not to be worn after leaving the patient room or procedure area. Mask. Wear a surgical mask if splashing or aerosolization of blood or body fluids is expected. Change mask between patients and sooner if mask becomes wet, moist or torn. Wear an N95 mask when it is indicated to enter an airborne isolation room and remove it only when outside of the room. Sequence of donning of PPE, personal protective equipments. First do the hand hygiene, then the gown, mask, either surgical or N95 mask, face shield or goggles, gloves. This is the picture how to put on the personal protective equipments. You can see here, clean your hands, put your gown, put the mask, put the eye protection, put on the last will be the gloves. How to remove doffing of PPE. First you have to remove your gloves. Clean your hand. If you wear the eye protection, remove the eye protection. If no eye protection, go to gown. Then clean your hand. Remove the mask outside the room. Clean your hand. Don't forget to clean your hand after removing the mask. Handling or disposal of contaminated items. Needles or sharps. Dispose used sharp items into an approved puncture-resistant container immediately after use, at the point of use as soon possible. Do not place used sharp items on any environmental surface. Do not recap or manipulate needles using both hands because this increases the risk of injury. Use one-handed scoop technique in case you need. Close sharp containers when it is 3/4 full. Don't forget, when it is 3/4 full, close the sharp containers. Medical waste. You can see the color coded of waste disposal management. The color code black bag. This is for the general waste. Yellow bag called medical waste. This is the waste from airborne isolation room and from the infected blood and body fluids. This is red bag for the pathological waste, usually used in delivery room or in the OR. This is a sharp container to dispose the sharps. All 3/4 full should be closed, changed. Linen. Handle and transport linen in a manner that will prevent skin or mucous membrane exposure and contamination of clothing or transferring microorganisms to other patients or the environment. Place heavily soiled linen in a designated impermeable bag, blue color bag, hamper bag, and close the bag securely. Minimally soiled linen in a white color hamper bag. So two color code bag hamper bags are there in the departmental area. One is blue, other one is white. Patient care equipment. Handle used patient care equipments in a manner that prevents skin and mucous membrane exposure, contamination of clothing, and transfer of microorganisms to other patients or the environment. Commonly used equipment must be cleaned and disinfected between patients. Do not reuse single-use items. Remove organic material from critical and semi-critical instruments or devices using recommended cleaning agents before transfer to CSSD. Ensure that reusable equipment is properly transported in leak-proof containers to CSSD for reprocessing before use with another patient. There should be a fire hazard label on the transport leak-proof container. Laboratory specimens. Wear gloves before obtaining laboratory specimens. Place laboratory specimens in designated containers and seal properly. Remove gloves and perform hand hygiene. Label containers with appropriate patient data. Transfer to the laboratory in upright position as much as possible. Ensure no leakage of the laboratory specimens. Room cleaning. Room should be cleaned daily and after patient discharge. Cleaning is required as per housekeeping policies. Patient placements. Place patients who poses as risk of transmission to others. Example, those with uncontained secretions, excretions or wound drainage in single patient room when available. If single room is not available, ensure contact isolation precautions are applied in a shared room. Cough etiquette. Cover the mouth, nose with a tissue when you cough or sneeze. Put used tissue in the waste bin. If no tissue, cough or sneeze into upper sleeve or elbow, not into your hands. Wear a surgical mask. Wash your hands with soap and water. If no soap and water are not available, use alcohol-based hand rub. Food and drinks at the workstation. Consumption of food and drinks in clinical areas with potential